End of summer is coming up, which means it's also back to school season. You might have even bought school supplies already, but have you considered checking your child's vaccination record? Well, this week, the Fraser Health Authority is helping school district superintendents prepare for potential measles outbreaks. Fraser Health Medical Officer Lindsay Bowthorpe is here to explain more. Dr. Bowthorpe, thanks for being with us.
Thank you for having me.
Now, Fraser Health data shows that 24 confirmed measles cases so far this year. Currently, there are none. But when kids come back to class, that could change. What are you telling schools about how to prepare for the potential?
Thank you for the question. And essentially, we work with our school partners closely. We have conversations with them 2 or 3 times a year where we meet with the superintendents and give them updates on public health programming as well as some public health concerns. Measles has been top of mind for the past few sessions. And as we are in our back to school phase, we will be again talking about measles, promoting immunizations, as well as encouraging them to keep up with infection prevention and control measures. For instance, regular hand washing, encouraging staff and students to stay home when they are ill, as well as to offer them with support and resources if they have any concerns that a staff or student has measles in their community. We do have public health nurses who work closely with the schools.
And what are some of the biggest concerns and safety measures to take when kids do come back to the classroom?
Essentially, immunization is the best way to prevent the spread of measles. It's a really effective vaccine. A child needs 2 doses to be protected against measles, and it offers nearly 100% protection against a measles infection. So we are really promoting measles vaccinations. We've been doing a lot of work to encourage vaccination and to get kids up to date. For instance, we've been calling the parents of kindergarten, grade 1 and grade 2 students who are not up to date for their measles vaccine and have been offering them immunizations before the school year starts.
And if parents worry about that the vaccine might not be safe, what would you want to tell them?
I'd want to tell them that it is a very safe and effective vaccine. As with all vaccines, you can get some minor symptoms that occur after being immunized in the days after being immunized. But overall, by and large, it's a very well tolerated vaccine. And as I mentioned, it's very effective at preventing infection. And I can say of the cases that we have had in Fraser Health, they have been unimmunized or their immunization status has not been known.
And looking ahead, what are some key symptoms to watch out for?
Yeah, great question. In terms of symptoms that a child could have, or really anyone with measles, is fever, cough, runny nose, red, irritated eyes. And then a few days later, an individual gets a rash. Typically, the rash starts on your forehead, the rest of your face, and then it travels down to the rest of your body. And that typically lasts 4 to 7 days.
Well, thank you so much, Dr. Bowthorpe. Again, that's Lindsay Bowthorpe, who is a Fraser Health Medical Officer.